Tiatus Junis. I'm one of the radiologists at Elizabeth Wendy Breast Care. I am subspecialized in breast imaging, so I'm a breast radiologist. We are seeing more and more women now that come in for their screening mammogram, and they may have had their vaccine for COVID a few days or a few weeks before, whether it's the first dose or their second dose. And we're noticing in their underarm area some lymph nodes that are a little bit larger than usual. This is a very common response to the vaccine. It means the immune system is working and the vaccine is doing what it's supposed to do. We're well familiar with this with other cases, such as the flu vaccine or the shingles vaccine, or even a patient that's come in after a recent viral infection or other illness that was from an infection. So typically what happens is if we do see lymph nodes that may be plump on one side, we will discuss this in a report with the patient that comes in and also let their doctor know. We may recommend you come back for an ultrasound in 4 to 6 months to make certain that the lymph nodes have gone back down in size to the size they were on prior mammograms. Now, if you're calling to make your appointment and you know you're going to be getting your vaccine next week, it may be a good idea to let the person scheduling your appointment at the call center know that, and we can schedule for your screening mammogram prior to getting your first dose or your second dose of the vaccine. If, though, this cannot be worked out, your time constraints, you cannot change your schedule, it is very important to have your screening mammogram. So we don't want you to postpone that or cancel it. Given the COVID pandemic, many women have postponed their mammograms now for several months or even a whole year. So we don't want to add to that. So if you cannot change the appointment because of one reason or another, come in and have your screening mammogram. And we certainly do not want you to cancel your vaccination because we know how difficult it is to be able to get an appointment for your vaccine. So keep that appointment. But we just want you to know that there is a small chance, about 10 to 20% of the women will experience some lymph nodes that will get a bit plump in the same side as the vaccination. And we may notice that on a mammogram when you come in for your screening, or even a screening ultrasound if you're getting an ultrasound because you have dense breast tissue. But it's nothing to worry about. This is quite normal, and we can easily figure out what is going on when we interpret your examination. Thank you.